For any parent, it can be just so confusing and frustrating. Your child has been totally dry at night for months, maybe even years. And then, suddenly they start wetting the bed again? It feels like this huge step backward. But what if it's not a behavior issue at all? What if it's actually a clue to a medical mystery?
So that's the big question, right? And that's what we're going to dig into in this explainer. We're going to follow the evidence piece by piece and uncover a really surprising and officially documented link between a super common childhood medication and this very distressing symptom. Okay, let's get into it.
Okay, so with any mystery, where do you start? You start with the evidence. And in this case, the single most important clue, the thing that changes absolutely everything, is getting the diagnosis right. First things first, not all bedwetting is the same. On one hand, you've got what's called primary enuresis. This is when a child has just never really been dry at night for a long period. Doctors usually see this as just a developmental delay. But then there's secondary enuresis, and this is a totally different ballgame. This is a relapse. It's when a kid who was dry for at least 6 months in a row starts wetting the bed again.
Now this is where it gets really interesting. Look at how the clinical approach changes. For the first type, primary enuresis, the advice is often just wait and see. Give it time. But check out the row for secondary enuresis. It says it warrants investigation at any age. And why is that? It's because it's a huge red flag that something new has popped up. Something has changed.
So let's be super clear about this. This is the key takeaway. If your child was dry and now isn't, this is not just a little regression or a phase. From a medical perspective, it is a clinical symptom. And that symptom is what tells us, okay, it's time to start investigating.
All right, so once we've flagged this as secondary uresis, our job is to find the disruptor. And just like in any investigation, we start by looking at the usual suspects, the most common culprits behind a sudden change like this.
So you round up the usual suspects, right? It's pretty logical. First, a doctor is going to rule out things like a UTI or diabetes. Then they'll look at big life changes, major stress like a move or a new baby. But look carefully at that last bullet point, medication-induced enuresis. Starting a new medicine is a really well-established, known trigger.
And that brings us right to the heart of our investigation. Let's introduce a new suspect that might not be on every parent's or even every doctor's radar. We're talking about the medication Montelukast.
Now, you've probably heard of it by its brand name, Singulair. It is an incredibly common, non-steroidal medicine given to millions and millions of children, some as young as 6 months old, to help prevent asthma attacks and treat allergies.
Okay, and here's where the plot thickens. This is a huge piece of evidence against our suspect. In 2020, the FDA did something really serious. They slapped a boxed warning. That's their highest level of caution on Singulair. Why? Because of a whole range of serious mental health side effects. This tells us right off the bat, this drug is known to affect the brain.
All right, so we've got our timeline. We've got a suspect with a known history of causing neurological issues. Now it's time for the smoking gun, the definitive proof that connects this specific drug to this very specific symptom.
Yeah, this drug has a pretty long rap sheet. The FDA warning was based on thousands of reports of things like agitation, anxiety, even severe depression. But I want you to pay close attention to the sleep issues, nightmares, and sleepwalking. These are what doctors call parasomnias, basically weird and undesirable things that happen while you're asleep.
And then, boom, here it is, the direct link, the smoking gun. This isn't a theory, this isn't speculation, it's right there in the official drug monograph for Singulair, the document from the manufacturer themselves. And right there, under reported side effects, it explicitly lists enuresis in children. Bedwetting. The case just got very, very strong.
And if you need any more proof, just look at this published medical case study from 2007. The timeline is just so clear. A child starts the drug, 2 days later, the bedwetting begins. It gets worse. Then they stop the drug and poof, within a week, the bedwetting is gone. But here's the kicker. Later, they try the drug again, and the symptom comes right back. That is pretty much the gold standard for proving a side effect.
So, the big question is, how does this even happen? Well, here's the thing. This isn't a bladder problem. It's a brain problem. We know that Montelukast can cross the blood-brain barrier, so the same disruption to the central nervous system that causes things like nightmares and sleepwalking can also mess with the brain's ability to get that, hey, full bladder signal during sleep. It's all part of the same family of side effects. Okay, so case closed, right? The evidence is all there, the link is clear. So what do you, as a parent or a caregiver, actually do with all this information? Let's move to our final section and lay out a clear path forward.
Think of this as your game plan for talking to the doctor. It's about giving you the language and the confidence. You can walk in and use the right terms: secondary nocturnal enuresis. Clearly lay out the timeline, when the drug started and when the symptoms started. And don't be shy about bringing up the hard evidence. Mention the FDA boxed warning and point out that bedwetting is a documented side effect.
And honestly, here's the best part of this whole story. The outcome is usually fantastic. Based on all the reports and studies, once the medication is stopped under a doctor's supervision, of course, the bedwetting and other side effects often just stop completely.
So I want to leave you with this one last thought. If you've seen a change in your child after they started a new medication, trust your gut. Your observation isn't just you being a worried parent, it is a valuable, critical piece of clinical data. And acting on that data is what can lead to your child's well-being, and in this case, a return to dry nights.